Good morning, good afternoon, good evening, wherever you happen to be located in the world and are taking part in this G20 Interfaith Forum and in panel discussion number 04, which is on the subject of faith communities and partnership to address COVID-19, the COVID-19 pandemic. As we begin, and to place the panel in some degree of context, allow me to offer three small groupings of introductory remarks. In the first instance, and although we have in passing referred to this during the course of the past day or so, the first reality of this COVID-19 global pandemic, with which we have been gripped for now just over 7 months, is that it is, for hundreds of thousands of people, a tragedy. And as we begin, I should like to invite you to take a moment to recall all those who have lost their lives, their families, and their communities in just a very brief moment of silence. Thank you. I have already been introduced this morning, and before further ado, I would like to note that there are so many dignitaries and persons of significance around the globe and from multiple faith and secular sectors taking part in this, that it would be impossible to acknowledge all of you. So I would simply take a cue from Canada's lead ambassador in the 1990s, the Honourable Dr. Lloyd Axworthy, and invite the rapporteurs this morning to simply note that all courtesies are observed. The first reality then, in the context of this panel, is that there is tremendous tragedy of all forms, human tragedy, that is driving the realities that we currently face. The second note that I would want to make, given that the nature of this particular panel is partnerships, is to note that in large measure, religious leaders worldwide have acted with compassion and insight and responsibility in respect to the various responses to the COVID-19 pandemic around the planet. It does need to be said, of course, that there are those in perhaps each of our traditions, and certainly my Christian tradition, who seem to be unwilling to acknowledge the depth and the breadth of the near calamitous and certainly unprecedented times in which we are currently living. On occasion, these responses have been problematic and have demonstrated an appalling lack of understanding of one's own faith. Certainly, that's true of leaders, secular and religious, in my own Christian tradition, and often an abysmal lack of insight into the reality of the science around the COVID-19 pandemic, of which we are still learning nearly every day, new twists, new turns, and new wrinkles. This would suggest that a dialogue, an ongoing dialogue between the overlapping but discrete magisteria of science religion is required, and that is in part the purpose of today's panel discussion. Thirdly, one of the great realities of this particular pandemic is that we have found ourselves living in a world of extraordinarily enhanced pace, of speed. We are using new technologies for communication, new technologies to deliver healthcare, new technologies to engage in work for those who are fortunate enough still to be employed, new technologies in terms of education. There is, of course, a digital divide that existed prior to the pandemic and in many cases has been deepened in consequence of the pandemic. And this panel, again, hopes to address those issues and those questions with clarity and with insight. Our panelists today are extraordinarily distinguished, and I believe all are now present, but it is our plan to spend our time in three sections or segments. And during the first of those segments, each of our very distinguished and extremely accomplished panel will have 7 minutes to express their positions and their insights into partnerships between and amongst religious and scientific communities. In the second block, we will seek to engage in a roundtable conversation amongst the panelists. And then in a third part of the conversation, should all go well, we hope to be able to entertain some dialogue through questions and answers, as already indicated in the chat, with you, those of you who have joined us from around the planet. Before I briefly note the various panelists, I'd like to invite you to check the various places on the website where you will be able to find the full biographies of all of our guests, our panelists for this morning. And allow me, first of all, to note the persons who will be with us this morning in the order of speaking, which is agreed by the panelists, will be alphabetical. The first panelist to speak this morning will be and I shall introduce all the panelists briefly first, is Dr. Nizar Bahabri, who is the director of the Internal Medicine Department at Dr. Salman Fakih Hospital in the Kingdom of Saudi Arabia. Dr. Bahabri is currently the director of the Saudi Society of Microbiology and Infectious Diseases in the Western Province and the vice dean of the Fakih Medical School, and his passion is public medical education. Should the technology cooperate with us, our second speaker this morning will be Ms. Sarah Ness, who is the team leader of the World Health Organization in the Information Network for Epidemics Health Emergency Programs through the World Health Organization. Our third speaker will be Rabbi Naomi Kalish, who is the Harold and Carol Wolf Director of the Center for Pastoral Education. She is a Kaisid Fellow. And Rabbi Kalish is also a doctoral candidate in Education and Jewish Studies at New York University and is writing a history of the Jewish entry into the field of chaplaincy education as part of a broader exploration of the teaching of multi-faith chaplaincy. Our fourth speaker will be Jean-François de la Vison, who, amongst many other accomplishments and positions, is the founder and president of the Ahimsa Fund, a nonprofit organization endowment fund, whose objective is to make good health contagious through innovative business and financial models. Our fifth speaker, Mr. Kevin O'Brien, who is based both in Cambodia and in the United States of America, is Executive Director of the Handa Foundation, of which you heard to some extent yesterday. Kevin's work is in development and involves faith-based communities, organizational sustainability, and regional healthcare responses to the COVID-19 pandemic. He currently serves, as noted, as Executive Director of the Handa Foundation. And our sixth panelist is Professore Dottore Marco Ventura. Marco is a professor, a tenured professor in law, religion, and religious diplomacy at the University of Siena, and the director of the Center for Religious Studies at Fondazione Bruno Kessler in Trento, in Italy. During the course of the next couple of hours, our panelists will be giving particular attention to three guiding questions. The first is, what challenges for long-term thinking does experience from the COVID-19 crisis suggest for global health policy and how can religious actors best be involved? The second question is, what specific opportunities do new technologies offer where religious actors can contribute to social cohesion and inclusion amongst their constituencies? And thirdly, how can religious leaders, policymakers, and civil society activists contribute to social cohesion across borders? And I think it would be fair to say that at the end of our 2 hours panel time, we will have a bonus. And that bonus is that Mr. Saeed Al-Matami will be joining us to offer a brief presentation on the work of Kaisid Fellows' recommendations in response to COVID-19. So please, as they used to say in the television world, stay tuned after our program for that additional opportunity. And so we begin, and it is my pleasure and privilege to invite Nezar to take the virtual podium. Nezar.
Okay, Bismillah ar-Rahman ar-Rahim, wa salatu wa-salam ala Rasulullah. Really,
Most gracious and most merciful, may the peace and blessings of Allah be upon him.
I am a physician. I am also a COVID-19 patient. I am still having some complication from COVID-19 after I treated so many patients. So I lived with COVID as a patient and as a physician. So in regards really to this great 3 questions, I believe COVID-19 affected all our life, and this kind of affection have really affected big part, as you know, in all the Arab and Muslim countries, affected the religion and how do we practice religion in Saudi Arabia. And in Saudi Arabia, as you all know, we have the 2 holy mosques, which is something that all the Muslims would like to come and visit. And as you all know, also, it affected the whole world in regard to their religion. So we had to take great measures, very strong and sometimes painful measures related to religion and non-religious to control the infection. One of the most first countries to close their borders, their international borders, were Saudi Arabia, which if they delayed this kind of intervention, they could have taken the infection from Saudi Arabia to every country in the world. I see now that there are great potential. It was a great year for us to learn how we can do our practices in life, in education, in religion. With COVID-19, we had to take great measures in our social affection and social contact due to COVID-19. We had to stop prayers in mosques. We had to stop education in classes. We had to stop jobs. This is all in the world. In the same time, technology came to solve a lot of our problems. And this is why it was a great opportunity for all of us to learn from it. And if anyone is asking about technology, I believe now technology were pushed significantly in Saudi Arabia to even interact in the jobs. We had to even translate the whole pilgrim period based on electronic apps. We are now restarting to open the Holy Mosque based on reservation of apps that you have to go in a certain time. And, and this is all affected the way how we look at things. And in this regard, if you look at what was the religious people and the religious leaders in this situation, they had crucial, the most important role, because this kind of role was crucial because it was affecting the soul of the religion of how to pray and how to do these things. And they did amazingly well, all of those religion leaders, in talking to the public and getting solutions approved to make our life easy to continue to practice our religion, and also to do everything possible to make sure that people are calm, they do not get depressed, they didn't get emotionally affected by all of this. This really helped the whole country to pass through this difficult time and to go through it with ease. We had to be a lot of us away from our families like the rest of the world. This has also affected our emotions. And the leaders of all of this religion, great leaders, helped the public to pass through, to know that this is something that we will pass through and get over, and we will get used to live and live in a population that have very small numbers of people with COVID-19. Also, people had to be spoken to when they get affected by COVID-19, to be relaxed by the medical field, because as like anywhere in the world, a lot of the medical field lost their souls. God bless them for what if they've done for their patients. People lost their lives, so a lot of families needed a lot of support emotionally and religiously to pass through this difficult period of losing good souls, good people that we love, especially if someone who is a child or a young guy who gave it to his mother and father, and then the mother and father died. This was painful, but we had to have the full support from the community, from the religious, from everyone who is specialized to pass through the public through this difficult moment. I have given hopefully a very small summary about the situation that we had to go through like anywhere in the world. I hope I've stuck to the period of 7 minutes. I will be happy to join later on the whole interactive session of questions.
Nizar, thank you very much for your insightful and compassionate comments and a first-rate summary. We look forward to engaging in further conversation during the second block of our time. If I may then just inquire, Sarah, are you yet on with us? Sarah Hess. It appears that we are still...
Continue with Mr.
Sarah,
de la Vison.
are you there?
Please continue with Mr. de la Vison.
We are slightly out of alphabetical order, but I'm hearing that we need now, and are privileged now, to turn to Jean-François Lavison for his presentation. We will return to Rabbi Kalish shortly.
Thank you very much, James, and thank you for the invitation. It's my pleasure to be with all of you today and to see a lot of well-known people participating to this forum. My past experience in the field of industry, humanitarian, and philanthropy convinced me that those organizations should not oppose each other, but on the contrary, should work together. This is the reason why I created Ahimsa 10 years ago. Ahimsa is an Indian word often used by Gandhi and quoted several times in our exchanges during those last 2 days, which means the respect of life and everyone's life in the world. Ahimsa objective is to bridge the gap between initiative and making health accessible to the poorest people in the world. For that, we need to stop to opposite what I call the extremes. We need to make work together the rich and the poor. If we want to solve the situation of the poverty, we need the support and working with the rich. We need to stop to opposite the youth and the elder. We need to use the wisdom and the experience of the elder with the dynamism and the optimism of the youth. We need to also work together between the local and the global. We don't need anymore to have a top-down approach. We don't need only to have a bottom-up approach, but we need to make all those organizations working together. On the field, we have a lot of successful initiatives to which we need to give more visibility. Our industries will have difficulties to reach the most vulnerable. It is not their model, their business model, and replicating the models developed in the North is not sustainable, efficient, and affordable. We will need different approach. We are going to have to start thinking the notion of sharing, partnering, and not always competing. It is commonly recognized that faith communities are often doing an essential work in combating extreme poverty, protecting the vulnerable, delivering essential services, and alleviating suffering. They have the field knowledge, we don't have it. We have started, but even more importantly, we need to develop a true, strong, and lasting partnership with faith communities. We spoke a lot actually about innovation, but we know also that more than 70% of technological innovation never have access to the poorest market in the world. It is through new effective partnership involving faith communities that we will succeed to reach the most vulnerable. It is because we consider it important to integrate and involve faith communities that Ahimsa has developed with a number of partners, many of whom are present in this forum, an international network also involving many communities on the ground. Their involvement in the COVID-19 pandemic is key. Indeed, discovery of tests and treatments are not the only pieces of the puzzle. We will need to develop innovative models to ensure that essential medicines and vaccines are affordable and available to everyone, no matter where they live. We need to build health systems that foster market access to testing, treatment, and other tools such as those for prevention. We need to amplify the voice of those who seek unity and cooperation to protect all people, including the most vulnerable. This is why we are launching a new initiative, Ahimsa Renaissance Movement, on the role that can play faith communities in the access of health to the most vulnerable in the fight against the COVID-19 pandemic. For the past 7 years, we have been organizing every 2 years large forums in collaboration with the World Faith Development Dialogue in Washington on the theme of health and religion, which bring together a number of those actors from the field to share and give visibility to what works. We see that the large prevention activity can be carried out. We are also working with a number of mobile care initiatives, train hospital, boat hospital, mobile clinics, some of which are run by faith communities to respond to this notion of market access in the field. We have done a lot of very good work with the World Health Organization and many other international organizations on the engagement of the faith communities. Yesterday, Dr. Tedros Adhanom, Executive Director from WHO, officially presented the Handbook on Social Participation, in which AIMSA collaborated, speaking on faith communities and their role in the health sector and the universal health coverage approach. I hope this will lead to need to involve them in our major public health partnership. What I can assure is that on the field, there is a great willingness and interest of all those actors to collaborate and contribute to common actions. I will conclude by reiterating that if we want to achieve the universal health coverage approach, the number one objective of the World Health Organization in the next few years, it will be essential to integrate, like any other constituency, faith communities into the worldwide global environment. I say this often, and I repeat it today, without faith communities, UHC will never be achieved. We know that all of us, we are different, but what I say, it is true, but those differences must be strengths on which we must build our future, not difficulties we must hide behind. Thanks.
Merci, Jean-François. Thank you very much for your comments. It's certainly heartening to know something of the work in which you and your colleagues have been engaged, and to take note of your call for cooperation and collaboration worldwide between the arenas of science and technology, innovation, and of course the worlds of religion. And your insightful call for unity and diversity is most appreciated. Now, friends, if you'll forgive me for a moment, I just want to try a technical check. I believe that we are still having some challenges connecting with Sarah Hess, but that being the apparent case, I would like to see Rabbi Naomi, are you present, and are you... I see that Sarah is with us. In which case, Naomi, if you'll forgive me, I'd like to attempt to return to alphabetical order as we agreed the other day, which gives you a few more minutes, of course, to benefit from the thoughts and expressions of your colleagues. Sarah, welcome. Thank you for joining us, and apologies on behalf of the entire team that there were some technical glitches. Welcome, and over to you.
Thank you. Can you hear me all right?
Very well.
Okay, I'm very sorry to be delayed. I'm not entirely sure what happened, but I'm here now, so thank you. I do have some slides, so yeah, thank you. There, I'll just indicate next slide when I'm ready to move on. It's really a pleasure to be here today. I think I don't need to tell anybody that we're 9 months into this pandemic. But we're really at that point now where it's been 9 very difficult months, and we're at the point where we're reflecting a little bit, I think, what has happened, where are we now, and what is the future looking like? And so, next slide, please. In the context of that, I just want to share a couple of reflections that I have that might be of relevance to this discussion today. So I think we're seeing some pretty interesting global shifts. The first really is these incredible dichotomies that we're seeing. We are living or have had to live through these unprecedented lockdowns, isolations, and physical distancing measures. However, in many parts of the world and in many different communities, we've seen these incredible displays of solidarity, looking after the community and protecting the vulnerable. And I think faith communities have long been these communities of care, often working amongst the most marginalized and vulnerable. And we also know that faith systems are complex and offer in many parts of the world, health services, education services, social systems of support. And so I think there's a really real opportunity now to call for an active inclusion and integration of these systems within national preparedness and response. The second shift that I think is incredibly interesting is that of the economic versus the public health response. And I think, unlike in previous crises such as possibly the financial crisis of 2008, we're seeing an increasing movement towards political declarations and rescue strategies that not only protect the economic well-being of countries, but really protect the vulnerable nationally and globally in the form of things like tax cuts and extensions of social protection. And I know this is a generalization, but we are seeing that. And I think the experience from many faith communities is that these value systems of promoting holistic health and well-being over physical or economic gain is really a value that we see echoing, and I think that's incredibly interesting. The third shift is really about the acceleration in the adoption of digital technologies, and this is something that's impacted everybody globally. I think big tech companies are estimating that the growth and adoption of tech that we've seen in sort of 3 to 5 months equals normally what we would see in 3 to 5 years. And I think this, everybody's adapted, including faith communities, moving services online and taking their messaging into the digital sphere of texts and WhatsApps. Next slide, please. So I think while we have these interesting opportunities, there are also these incredible crises that are emerging concurrent with the COVID pandemic. And I want to just highlight them quickly because I think we can discuss a little bit later on in the panel some of the opportunities that they present. So the first is really the politicization of the pandemic. Obviously, we know from COVID that viruses don't respect or don't recognize political leanings, nationalities, or borders, but they can definitely be politicized. And I think there is really a need for solutions that go beyond geopolitics. And for faith communities, they have international and transnational connections and also connections with remote and hard to reach populations. And I think that presents an opportunity. The second issue is that of the exacerbated inequalities that are happening. I think, physical distancing and isolation have been experienced differently in different parts of the world, particularly in societies where there is no social support and safety nets. And I think that this is an area of grave concern. Another interesting crisis really is that of the infodemic and health literacy. We're seeing this overwhelming amount of information, and it's difficult to identify trusted sources and for people to be able to make decisions for their health accurately based on that information. And I think that represents an opportunity for faith leaders as trusted sources of information. And the third, I think, is the completely underestimated impact on mental health that we're seeing throughout the world. Next slide, please. So I think just briefly, in the words of Arundhati Roy, the writer, the pandemic is both a huge crisis, but it's also a portal for opportunity and a space to kind of rethink many things, including how we live and how we work, how we engage with scientific knowledge, how we provide healthcare, how we relate to others. And so I just have two sort of high-level takeaway messages, really. Technology is best, but it's only best when it serves as an enabler. And so I think we really need to focus on how we take that technology and harness it for for good. And but really with the recognition that technology does not replace that human connection that we value so so much. We are human beings that are meant to be in community, and I think that's something that has really impacted everybody during this time of physical distancing and isolation. The second takeaway message is that, particularly from WHO's perspective, we would like to recognise faith communities as an integral part of emergency preparedness and response, recognising that in many parts of the world, faith communities are part of those resilience and social cohesion building movements that come from the community. I'm going to end there, but I look forward to the discussion later on in this session. So thank you very much for having me.
Sarah, thank you so much for that well-stated picture of those elements of the pandemic which provide possibilities and those which constitute threats, but also for your two final points, which again emphasize the necessity of the, call it, scientific community, globally speaking, and the religious communities of working together. It was the late Freeman Dyson, an astrophysicist of all things, who said that posterity would hear two voices from this particular juncture in history. One of those voices, Dyson said, would be the voice of science, and the other voice, the voice of religion. And all of our panelists so far have emphasized that, and Sarah, you certainly have noted these metabolic shifts, as the late Karl Marx would have put it, I suspect. Naomi, are you available and ready to come on board?
Yes, I am here.
Welcome. Good to have you with us, and over to you.
Thank you. I'd like to begin my remarks by thanking all of the organizers, moderator, and fellow panelists. It's a privilege to be part of this conversation. I will be focusing my comments on organizational structures for the inclusion of religious actors in disaster response, with an emphasis on responding to the COVID-19 pandemic and how we can optimize the service of religious actors. I do this from the perspective of being a rabbi, my work as a hospital chaplain on the front lines, and my work in leadership positions in chaplaincy and as an educator. I will be emphasizing how training is a critical component of preparedness, how interfaith collaboration is crucial, and I'll be doing this by offering a case study of what chaplaincy has to offer the provision of services in disaster situations. But let me start by sharing a personal story. I was attending a chaplaincy conference in January of 2001. There was a workshop offered after the conference by the Red Cross in spiritual care, in disaster spiritual care. And I thought, sure, I'll take this training, but I don't see this being relevant in the future. I work as a hospital chaplain. Little did I know that 7.5 months later, in my city of New York, we would experience the September 11th tragedy. On that day, I was deployed to a hospital in my local community in which we received people leaving New York City seeking care. During this time, of course, anxieties were high and multiple questions arose: who could enter the scene and who could and who should not be? What were the criteria? My Red Cross training was incredibly significant for gaining entry into caregiving at that moment. But what I'd like to emphasize also is that this training wasn't only helpful in responding to the human-made disaster of that terrible situation, but also laid the groundwork for all disaster response. After Hurricane Sandy, in which our city became flooded, and of course, currently during the COVID-19 crisis. So what constitutes a disaster? During a disaster, the typical structures for day-to-day living and even for emergency response become insufficient. New structures are needed, and this is what disaster plans provide. of course, often in a disaster, even the disaster plans are insufficient and the plans need to be rewritten. We've seen this both in terms of medical care, education, religious services. Every segment of society has had to be rewritten. Also, during times of disaster, caregivers are also care receivers. And we've heard this very sadly and also tragically, even among us on this call, us at this conference, we have experienced losses, we have experienced illness. We have experienced the mental health ramifications of the crisis. So what are the challenges for long-term thinking that I'd like to address through the example of chaplaincy? The mental health crisis, the exposure to trauma, complicated grief, and spiritual distress. And of course, the comment mentioned already, we have an illness within an illness, or as one speaker recently said, we have a pandemic within the pandemic. These social justice, human-made tragedies and challenges we are experiencing in response to this natural disaster. So how can religious actors be involved? Through the institution of chaplaincy and training in disaster care, religious actors can both increase the provision of social services as partners to government and intergovernmental agencies and NGOs, and also play a unique role that is specific to the spiritual care leader. Training can take place in two different modes. One is a specific training for spiritual care first aid, as it's sometimes called, and the second would be more in-depth training. Clinical pastoral education is fairly common for most clergy in the United States, whether they're Protestant, Jewish, Muslim, Buddhist, and other faith groups. These trainings can be applied to any context in which a faith leader works, within their own community, in a congregation or other setting, in a chaplaincy position, or specifically in disaster chaplaincy. I'd like to make the argument that no matter what position a religious leader is working within, this training would be significant. The health field over the last 20 years has dramatically rethought its model of care. Historically, medicine has been based in a model that has emphasized biological care for its model. In the 1970s, this was rethought, and we were introduced to the model of care called biopsychosocial, the integration of mental health as well as social needs as we consider a more holistic care for individuals and for their families and support systems. In 2002, Dr. Daniel Solmese introduced the model of care called the biopsychosocial spiritual model, arguing that spiritual care is essential for a holistic model of care and provides something distinctive from the others. A lit review on PubMed reveals over 11,000 research studies and publications on the topic of spiritual care, spirituality, and spiritual care education. These studies and explorations have been raised within all areas of healthcare, from medicine to psychology to social work to nursing. Additionally, these research studies and publications also span the globe. I myself wrote a lit review a few years ago and encountered articles from Hong Kong, from Saudi Arabia, from Oman, from India, from the United States, from Canada. So we see a model in healthcare which speaks loudly to the importance of the inclusion of a spiritual care component in the provision of healthcare, which of course is relevant to our discussion of COVID. These articles speak to different outcomes, and it's beyond the purview of our conversation today. The literature addresses different outcomes from different areas, whether it's administration, social services provision, mental health outcomes, for the importance of the inclusion of spiritual care. What does training in spiritual care actually provide religious leaders? First, it introduces them to disaster response. It helps religious leaders and actors understand the phases of disaster, preparedness, impact, recovery, preparedness for potential future incidences. This field is also distinctive in that the training emphasizes what's called multi-faith competency, which is similar to multicultural competency, except specifically with regard to the care for people from diverse religious backgrounds. Multi-faith competency also addresses the issues that we have been discussing around the injustices in the provision of healthcare, which we see socially, that vulnerable populations suffer more than those with privilege. We have talked just on this topic about what I would call the significance of encountering human suffering and to what extent that can be transformative. I do believe that encountering human suffering across difference can be transformative and can be a stepping stone for peace building and conflict resolution. So the question is, what kind of encounter can prompt that? What kinds of encounters reinforce social differences and injustices, and what kinds of encounters can be transformative? And caregiving has the potential, I believe, to be a transformative encounter. Additional outcomes of the trainings and consequences for inclusion in our disaster response teams include an emphasis on care for the caregiver. As we know, caregivers as part of the pandemic have all been impacted in one way or another by the pandemic. And the caregivers include both frontline medical and healthcare workers, as well as clergy and religious leaders, as well as, I would say, all of us. We also need to pay attention to what's often referred to as secondary post-traumatic stress disorder and compassion fatigue, the distress that can be caused through the process of listening to traumatic events, even if one is not directly in response, and also issues of burnout. The chaplains and faith leaders become part of the professional team, which means that they can uphold and be knowledgeable of standards of the organization, ambassadors for the core values, and provide care to the staff. I believe I am approaching the end of my time, so I will conclude with the question of what do religious actors need if we think of religious actors as both partners as well as recipients of care. I've made the case that they need training and to be included in the structural responses to disaster. And it's also important to view religious actors as the recipients of care and of service, as many have been affected by the violence, the virus, have experienced xenophobia, have had to muster the energy to redesign religion during this time. And we are also hearing about a crisis of a crisis of, I wouldn't call it a crisis of faith, but a crisis in terms of continuing in their vocation. And as faith leaders are part of the team, we want to, for sustainability, maintain wellness in order to continue to partner with them. Thank you.
Naomi, thank you very much, both for grounding us very solidly in the practice of faith in the front lines during the midst of this pandemic, but also in your closing remarks, you noted the redesign, or in some respects reinvention even, we might say, of religious practice. And that really, in many of our religious traditions, is something that every generation is required to do, to, in a living faith, assess the times in which we live, and then apply our theologies and our faith practices to the realities that we must address. So thank you very much for that. Kevin, I'm not sure if you're joining us from Thailand, but if you are, you must be exhausted, and thank you for being with us today. Of course, if you're in the United States, I withdraw it. Kevin, over to you.
Very good. Thank you very much. Appreciate it very much, your introduction, Dr. Christie. I definitely want to talk a little bit about one of those wrinkles you mentioned in your introduction related to COVID. But first, I wanted to mention that I'm from an organization called the Honda Foundation, and we're on the ground in Cambodia and in Laos, and we build sustainable hospitals and schools throughout Southeast Asia. So this is kind of one of those stories from the field, and I'll keep it brief, but I wanted to kind of bring a wrinkle, one of those wrinkles you mentioned about COVID, kind of to the story here today. Our founder, Dr. Honda, also leads an organization called WSD, and which was the lead host of last year's G20 Interfaith Forum in Tokyo. And we were very grateful to be able to be the host at that time. We think it was a great success last year. There's nothing more intercultural or interfaith important than the pressing and relevant challenge of COVID. And so I wanted to mention the story that we have where we work the most, which is in Cambodia. And Cambodia seemed like an easy target for COVID. When it first broke out, we were panicked. There's 25 flights per day into China from Cambodia, and the healthcare and education systems there are pretty underdeveloped, so we're very concerned. But as you can see on the next slide, if you go to the next slide, upper left, if you can read that, it says there's been 283 cases this year and 0 deaths. And so most people read that and they say, fake news, that can't be true. And we directly or indirectly manage 7 health facilities in Cambodia, and we serve a total of 280,000 patients per year. In each facility, a special ward was set up for COVID when this all started. From March until today, we've had many suspected cases, but we've not had a single COVID in Cambodia in our facilities. So the question then is, how is that possible? This is true. There's been 0 or very nearly 0 deaths in the whole country and very few cases. How's that possible? And so there's many theories going around, as you can imagine. Some say it's a low population density, tropical climate, having tourists that remain to themselves, the fact that most of the population is under 30 years of age, and the government's had a very strong, consistent response as well. I'm not going to be as controversial to say exactly what I think the answer is, but what I am convinced of, and if you go to the next slide, I'm very convinced that it involves culture and religion. And the reflections, some of the reflections on the pandemic is that, Cambodia does have fewer healthcare resources. It's had less testing per capita than anyone else in the region. It did not close its borders as quickly as everybody else. It has a similar population density and climate and youth population to its neighbors in the region, but they all have more cases than Cambodia. So there's something going on there. And I think some of the pictures I show here give some of the answers. Culturally speaking, as someone mentioned earlier, I believe Father Augusto, the value of community is much higher than the value of individuality. And I think that's a very big part of their religion and a very big part of their culture. Their pagodas are open air, and they're very closely following health policy. And if you go to anywhere in Cambodia, including a pagoda, everyone has a mask on. There's no it's everybody by the government. And actually, before the pandemic started, there was already an expectation that if you have a cold or any kind of illness, you wear a mask to let other people know to stay away from you. And that's interesting that existed even before the pandemic. In the picture there, I show a picture of the Prime Minister and the King in a public gathering. And guess what? Every one of them has a mask on, even the King. And that's just expected. That's what you do when you're part of Cambodian society, is you think about one another and you take care of one another. The government leadership there, I do not often praise it, but this time I am, because I believe that it's been strong, consistent, and well-informed. And the emphasis they've put is on contact tracing to the 3rd level of contact, and they're even supported by the military, which I guess helps enforce those rules. They utilize a phone app and other procedures that are actually developed by the United States before 2020, and they're actually using them effectively. And they have about 2,500 government workers that they've trained to use those apps to trace people and to make sure that everyone is compliant with the direction given by the government. So in conclusion, reflecting on the Cambodian experience, I would say that if it's true that the progress in Cambodia is related to culture and religion, then it begs a closer examination, because there's surely something there that we can all learn from. And that's what I wanted to share, and I appreciate the chance to be a part of this panel. Thank you.
Kevin, thank you very much for those insights and that really very tightly presented, but nevertheless extensive case study of the experiences in Cambodia. I must say, coming from a part of the world where the question of caring for one's neighbor through the simple, expedited process of wearing a mask is often up for grabs and derided by many, including those, sadly, in political office. Certainly your insights may give some who need a pause to think about this, precisely that cause. And we appreciate the insight and look forward to more conversation in a few minutes in a roundtable amongst all our panelists. Before, however, we turn to that next section on our program, our concluding speaker on our panel this morning, afternoon, or evening is Dr. Marco Ventura. And Marco, welcome from, I imagine, still Siena. It's good to see you and good to have you with us.
Thank you very much, Chair. And in fact, it's evening here. So good evening, everybody. I'm really honored and pleased to be a part of this panel and to humbly contribute to this fantastic event. I hope the technical team will be able to share my PowerPoint. I will give some remarks based at the same time on our experience at Fondazione Bruno Kessler. We have a partnership between my two hats, in fact, the University of Siena and Fondazione Bruno Kessler, and some general remarks. So next slide, please. And as you can see, the beginning and the end of my presentation will be based on work at Fondazione Bruno Kessler. Next slide, please. And the first part will be, in fact, based, thank you, on the work that Fondazione Kessler led a team of researchers led by Stefano Merler to be decisive, and we can go to the next point in this slide. They were those who started from groundbreaking research on the spreading of Ebola, and this research was actually funded by an Italian Christian Catholic NGO, QAM, and the Bill and Melinda Gates Foundation. It was actually praised, this research, by Bill Gates in person. Next point, please. The elaboration of decisive predicted data on the spreading of COVID-19, and it was thanks to this report, which was secret at the time, that the Italian government actually adopted severe lockdown measures, which was, as you might recall, the first case in Europe. Well, speaking about partnership, this, next point please, was a partnership between engineers, computer scientists, and health professionals and data analysts in a research, next point please, in a research institute combining research in science and technology and specifically within our center, research on religion. Now, next slide, please. And now I'd like to share a few thoughts about what the challenge on partnership has been and still is during the COVID-19 emergency. Next slide, please. And it is, first of all, a challenge of actors. You can see from the next slide. It's been a challenge in terms of partnership with governments. This was mentioned already during the plenary. government officials who were not able to understand, actually misinterpreted the needs and values of faith and role of faith communities. I still hope we can move to the next slide here. And then a partnership with health authorities. Yes, if you can, exactly. Then the next point, the partnership with health authorities. This was a major challenge, of course, for faith communities. Next point. And then interfaith and interreligious partnership. And finally, fourth challenge, not to be overlooked, partnership within religious traditions and faith communities. And next slide, please. Then the challenge was also about tools. Yes, please. The first point is policies. Faith communities had and still have to elaborate policies, to elaborate strategies, to either react and improvise, and also at the same time to elaborate plans. And then laws. This is the next point. Of course, there was a major challenge about norms, either how to cope with state laws of the land, and how to shape and reshape religious laws. And then finally, technologies. The third point. This was also a major challenge in terms of tools. And here we come also to a third set. Next slide. Thank you. First point, a set of challenge items, one being adaptation and flexibility. This is the first point. Faith communities have to decide to what extent it would be possible to adapt and be flexible and be an example. But at the same time, they also, next point, had to defend the freedom and the autonomy. And as we know, this has been another major challenge. And the third challenge, someone mentioned already in the panel, the issue of literacy. There was this is the third point, a major challenge: literacy and knowledge. Of course, literacy in health, literacy now in vaccines, and at the same time, literacy in religion. Next slide, please, and we'll now look very quickly at how the partnership challenge is going to be beyond the COVID-19 emergency. And here I would like to point, please, next slide, at the 5 main kinds of challenge. Next slide, please. The first point is partnering with the research and innovation community. This is really essential. We cannot leave the research and innovation community alone, to some extent in isolation. Second point, please, partnering with the business community. Someone mentioned industries already. And this is, of course, a major challenge for our G20 Interfaith as a whole. Third challenge, connecting ethics and values and development-oriented action. Faith communities tend to be strong in a discourse on ethics and values. It is very often not as strong, at least in terms of visibility, what they can do in action. And then another point, align researchers in social sciences and the humanities and researchers in science and technology. And a final point, building jointly digital literacy and religious literacy. Now, I will conclude in the next few seconds with the following slide on recommendations. So the next slide on recommendations. I believe that it is very important for faith communities to be able to leading by example. This will be crucial in terms of the interaction with the community of the business sector and research and innovation. The next point, at the same time, faith communities have to be, and they have to be acknowledged as and partner with as laboratories of a human-centered artificial intelligence and digital technologies in general. For health and well-being, as far as our analysis of COVID-19 impact is concerned, but also and beyond. My final slides will be on just how we at FBK try to be ourselves a laboratory in this sense. So the next slide, please. our understanding is that we need to bridge the gap between work on innovation, next slide please, and religion. Both are crucial for sustainable development. There's a lot of investment on innovation. There's a role for religion, and there's an interaction with innovation, which is key. We have contributed in February 2019 this position paper, which is easily accessible on our website, with its 11 recommendations. The next slide. We also have some projects that I'd be happy to share with you. They're on our websites on the security, circulation of data, on digital literacy and religion. You can see those, and the technical team is great in following me here. And finally, probably the most important document, the next one, is our response document to the European Union Commission in the consultation on the white paper on artificial intelligence. In this document, we were very open on the role of religious and faith communities, which is not only one of ethics and values, but it is also one as a laboratory of bridging the gap between religion and innovation. Thank you so much.
Marco, thank you very much for your very clear presentation, emphasizing the myriad ways in which cooperation and collaboration amongst the various entities of innovation, technology, infrastructure, and religion are cooperating together, and the potential for a much greater and further collaboration and cooperation as we move into the future. Our host, Marlene, and our program manager, Sana, are monitoring the chat, and I would invite you, those of you who are listening and participating virtually, to place your questions or comments that you would like us to address, time permitting, during the third block of our panel time this morning. Before moving to our next section, which is a roundtable amongst the participants, in which we will challenge our technical hosts and our translators probably beyond reasonable measure, it is my pleasure to modify our event slightly by asking Mr. Saeed Al-Matami to make a brief presentation from the CAICID Fellows in terms of the COVID-19 and their work in the area. Saeed, welcome.
Thank you, sir. First of all, we would like to thank CAICID for this opportunity to share our inputs and discussions for this noble goal. CAICID Fellows shared their ideas in different topics, and we had in our consideration some general challenges. Some were mentioned by the guests before, but we'll see it briefly, such as social inequalities, xenophobia, distrust of agencies, disaster response infrastructures are not available everywhere, poor cultural competency, need to redesign structures for engagement. We also put in our consideration the challenges to incorporating religions, such as absence from protocols and definitions, distrust of religion, hard to measure, and finally, disaster chaplaincy and disaster spiritual care are not widespread. We have concluded the following major recommendations from such as establish an infrastructure with religious communities that will optimize management of health crises within religious communities. Second, include religious actors and experts in interreligious dialogue, such as CAICID Fellows, into your strategic planning and initiatives. Provide training in disaster spiritual care, and finally, incorporate disaster spiritual care into all disaster response plans. Thank you, and that's all our recommendations.
Saeed, thank you very much for being with us and for bringing us up to date on the pre-forum consultation of the CAICID Fellows on COVID-19. You are welcome, should your time permit, to remain with us, of course, and you may have interventions you would like to offer in this next or closing phase of the panel discussion. Now then, again, according to our agreed upon agenda amongst the panelists for this morning, we are going to take roughly half an hour and I hope bring successfully all of the panelists onto the screen, and we will attempt to elicit from the panelists their responses one to another or amplification on points that they might have made based on those panelists who followed them, or for that matter, on Saeed's insights received from CAICID Fellows. Just before I do that, let me remind you that during the last 20 minutes or so of our conversation, we will turn to questions that have come in and that Sana, our program manager, and Marlene, our technical host, are carefully monitoring. So once more, do please feel free to engage with us, and we'll do the best we can to at least offer some modest response to your questions and your concerns and your insight. Who would like to go first?
James?
Jean-François.
Yeah, then thank you very much. And really, it's a pleasure for me to have such a fantastic panel, so well managed by you, James, and pleasure to see some good friends who are attending the panel. My question is to say that we have so many initiatives, all of us on our side, and I think we should find a way to better exchange or bridge or communicate between us in order really to use as much as possible those great initiatives that all of you just mentioned.
Well, thank you. Actually, a number of our panelists noted the need for finding ways to share information and to integrate more clearly, or to at least coordinate many of the responses, and that is essentially the nature of partnership. So I wonder if those of you who spoke on collaboration, coordination, and that's really just about everyone to a greater or lesser degree, would like to offer some suggestions in response to Jean-François. In a moment, of course, I shall exercise the moderator's prerogative to be arbitrary, but I'll count down in case. 3, 2, 1. Sarah.
Can you hear me all right?
Yes.
Yeah, okay, because I don't have a mute function because I'm on my phone. So anyway, I'm not sure if I'm being heard or not. I mean, I think coordination it's not an issue isolated to this discussion at all. We see it at every level of the response. With coordination, I think there comes a certain amount of leadership too, and that's a whole nother question in itself. So who's leading that coordination? Who has the oversight? What is the communication plan around the different entities that are being coordinated? Is there the willingness for those entities to be coordinated? And I think it's an extremely complicated discussion to have, because it goes into a discussion around mandate as well. So, but what I think, I mean, what Jean-François was trying to get at is that we definitely could be stronger and more effective if we built on the initiatives that everybody else is doing, instead of acting within our silos and within our own paths. And I think part of achieving that can be quite organic in terms of finding that coalition of the willing who and like-minded with whom you can work. But at the other end, I think there really is a need for coordination, which is a little bit more of a top-down approach. Whether that happens at a national level, at a global level, I think it depends on the setting and the context. But I'd be interested to hear what other people think as well.
Thank you, Sarah. It certainly is interesting to think of the ways in which the virtual technology, which we're all employing and enjoying for that matter this morning, is demonstrating just how many people and communities and organizations worldwide are finding not perhaps the same approaches, similar even approaches and similar strategies, but rather are recognizing common concerns, common problems, common challenges, which would be more of the organic or evolutionary approach that you suggest. But I wonder, Marco, Saeed, you also particularly struck or made mention of questions of strategies of collaboration. Saeed, you noted the need to develop what Sarah has suggested might be a more globally top-down system of engaging in exchange of data, of information, of strategies. And I see that Nazar is hoping to intervene, and I'd be delighted if you do, and perhaps we'll come back. And I'm going to start that ubiquitous thing, a speakers list. So Nazar and then Naomi.
Okay, really I have been delighted to hear from everyone's experience, and I believe our first beginning of collaboration can start with what we are doing now, because every one of us heard a lot of great ideas happening. He can once get in close contact with every one of us and get the like if I can speak to the training idea was amazing. So you can get the curriculum. You can start from being a simple connection in a one-to-one level. Then you can even take it further from this great firm and then develop a curriculum that you can distribute all over the world, because this is something that what we want to do all. We want everyone, we share our experiences with it. We all can share experiences with whatever religion, whatever ethnicity we are living in. And we can come up with a simple idea that we can distribute all over.
Mm-hmm. Well, thank you, Nazar. As a matter of fact, in Canada, one of the changes in the last 2 decades has been to rebrand, as our friends in business say, the Canadian Association of Pastoral Education into the Canadian Association for Spiritual Care, precisely to emphasize the multi-faith nature of the kind of training that Naomi was speaking about. But Naomi, you wish to make an intervention concerning technology in particular, but I wonder if we could also invite you to respond to Nazar to the extent that you think or imagine that programs like clinical pastoral education or supervised pastoral education and spiritual education can be translated into a variety of global contexts. So Naomi, over to you.
Yes, thank you. I'll respond to both of those. I think there's absolutely potential for what you suggest in terms of an application or a translation into global contexts. The chaplaincy field, and actually I'm going to pick up on Reverend Christie, your language, the spiritual care field is a global field. I'm part of a research council which has probably at least 15 different countries throughout the globe located on it. There is obviously the necessity to translate what spiritual care looks like in different cultural contexts to be appropriate. But as you mentioned, the shift of language from pastoral care to spiritual care embodies a commitment to diversity and difference and inclusion. So this actually connects to, I'll just throw in one additional short comment before my comments about technology, which is that these structures, like what you mentioned, the Canadian Association for Spiritual Care and other chaplaincy countries already have an infrastructure which would be highly effective to engage, because these are religiously diverse organizations with hundreds, if not thousands, of members within different smaller regional contexts. And so in terms of a next step, I would recommend that we engage these organizations. Like I mentioned, I did a first training in the context of a conference. We could reach a very large and diverse audience, and each of those members has a connection with their own faith community. So it would have a ripple effect. The comment I wanted to make about technology is to share and reflect on the experience we had in New York and throughout the United States in shifting our chaplaincy education to an online educational program. We use the Zoom platform, and also a shift of our caregiving to what's being called in the field as telechaplaincy. That's basically the spiritual care version of telehealth or teletherapy, that we're seeing many different caregiving and service providing being moved to online platforms. And this was incredibly effective, and I recommend further exploration. Also, though, with the caveat that with this, of course, we need to be remembering who is not included in certain uses of technology. So we had students who needed to withdraw from the program once the United States was in a sheltering in place mode. We had people who had childcare needs, who were needing to put their professional or educational lives on hold. And of course, this was disruptive to them in that sense. Of course, there's financial implications there as well. And we also had patients and clients who could not be reached through the telehealth methods. So most specifically, we served people in elder care programs, people in psychiatric mental health services, and also people in hospice and end-of-life care. And our service was mostly for family and staff in those cases, and people at the end of life we were not able to reach.
Naomi, thank you very much for that. There are so many ways in which perhaps we can learn more effectively to connect one with another. Before turning to whoever wishes to speak next, I would like to pick up on one note that Nazar, you mentioned, and that was that people who are attending to this forum from around the world might wish to recognize that they have access to all of us on this screen. The G8 and subsequently the G20 summits and fora have been active since 2005, when the first was convened by the then Archbishop of Canterbury, Rowan Williams, and Jim Wallace, the founder of Sojourner magazine. And many of those fora and many of those summits have been what we might call event experiences. They were gatherings that occurred once a year, and then little perhaps was pursued during the course of the ensuing 12 months. We in the Interfaith Forum Association, G20 Interfaith Forum Association, and I know CAICID, during the 8 years of its existence, are not, however, concerned with simply an event once a year associated with the G20. We are year-round program organizations, in some measure research organizations, and in consequence, we would encourage those of you who are engaging with us from around the planet to engage with us during the next 365 days, give or take a month, until we gather in Italy. And to, in the case of I of 20, where I can speak as an advisory council member quite confidently, we have a series of working groups which we're establishing that will help you focus your questions, your comments, and your interest in engaging. CAICID will have its own structure, of course, to that effect, but I don't feel confident enough to speak to their ongoing work. To come back to that question of collaboration and international coordination that Jean-Francois raised, I wonder, Marco or Said in particular, have you a comment you would like to make? And actually, I'd like to include you, Kevin, in this as well. During the course of your comments, I recall you mentioning those two twin poles of the global and the local. And that seems to me certainly to be critical in the question of organizing and coordinating our responses, not only to this pandemic, but to all the other, as I mentioned earlier, metabolic shifts, which we can count on being faced with in the months, the years, the decades, and the centuries ahead. So no particular order, just the way you appear on my screen, perhaps Marco, Said, and Kevin?
Yeah, sure. My perspective is one of the organization of research as someone who's responsible for a research center. And what we observe from continental Europe is the shift towards a more collaborative patterns of research. It's because of the structure of funding to some extent, but it's of course much beyond the structure of funding. It's also as a necessity in view of a better connection with the employment perspectives. So it's a much more. It's as I see it. From the experience of my generation, it's a dynamic, open world, and again, I believe that the work on religion and the work of faith communities can be a fantastic laboratory. But that's the challenge when we come to the key word for our panel: partnership. The key challenge is to see faith communities from the outside, and that faith communities see themselves from the inside, not at the receiving end of government initiative or research agencies or scientists, whatever is out there. And faith communities need to see themselves and help others to see them, not at the receiving end. They have the responsibility to be themselves the laboratory of partnership, of collaboration, including and first of all when it comes to technologies. And I think this is the key challenge of the multiple dimensions of a partnership and collaboration, and we've been already highlighting some of the most important.
Thank you. Said, any thoughts?
Oh yes, sir. One of the main concerns to collaborate is it should be measurable. That's an important thing for the policymakers. I mean, in the end, they want results. That's one of the things. As Mr. or Dr. Marcos mentioned, it should to be as an initiative from the religious actors. It will cause a problem because it won't be measurable also, and that's one of the main things for me is. Even if you want to persuade the policymakers, we're talking about if it crosses different policies, which gains more benefits for them. I mean, that's one of the things we talked about. As I mentioned it was about disaster chaplaincy and disaster spiritual care are not widespread. There is a lot of best practices which we saw the panelists talked about, but if anything that can persuade the policymakers to approve and go on, I think everything needs to be measurable. That's from my point.
Okay. Again, thank you. Kevin, local, global, other polarizing issues.
Yeah, I think it's interesting because being in part of an interfaith forum, I've been a part of several, and I know that what connects us so well is facts. We come together, we're addressing a real, true problem in the world. We want to change the world, and here's the facts. That's very unifying. And then also the fact that we come together to listen to each other and each other's experiences, that creates the collaboration, because if you come to speak, not to listen, there's no collaboration there. And so I think I look at the world today, and we know science works, fact-based medicine and science. We know that collaboration is effective, but neither one of those works without leadership. And so when I go to an Ahimsa forum and Jean-Francois is giving everyone hospitality and leading us to sit down and listen to each other, wow, we get a lot done. But how do we get that to happen on a bigger scale? And I don't know if there's some way to get the leaders in place today to feel the pressure, but the thing that gives me hope about this particular time in our lives is that this experience we're going through it's global. It's not an experience that's just for one region. Worldwide, we're all going to remember 2020. And I think the technology has connected us. It separated us sometimes, but it's also connected us in a way that we have a common experience with the pandemic in common convictions and common truths that go forward. And I'd love to get this is a crazy idea, but a cultural collaborative leadership score to every leader in the world and the leaders of regions, and say, are you really, and correlate that with how well people deal. We can almost predict the death rate in a lot of countries by how the leadership is either collaborative or not, or culturally intelligent or not. And in fact, give a score to those people and let them feel some pressure. Like, why do you have such a bad score? I'd love to. I don't want to change the world. I'm just saying, how do we take this conviction and experience and really let people feel the need to work together? So those are my thoughts.
Gee, I don't know, Kevin. I'd love to change the world personally. Of course, it probably wouldn't work according to the way I would like it to, but still, in principle. That's an intriguing thought you make around a culturally collaborative leadership course, and I'm sure I'm not quite quoting you correctly. There is some pretty groundbreaking work in that field. For example, I guess it's the Wolf Institute at Cambridge University has done some remarkable work with, for example, the Metropolitan Police Force in London, and not that rather horrific phrase, cultural sensitivity so much, but certainly an introduction to cultural awareness. And there are many ways in which we can do that. It probably also should be noted, Kevin's mentioned that he's been a part of many of the G20 Interfaith Fora, and a number of us are really greeting old friends in this world which we currently inhabit. But looking forward, I cannot imagine, and I certainly hope that we never revert solely to face-to-face gatherings, nor for that matter, that we go solely to virtual gatherings. One of the reasons that many of the initiatives worldwide have been, I think, effective is that there are those amongst us, and this refers perhaps to leadership to some degree, those amongst us who have been colleagues and friends over breakfast, lunch, dinner, breaks for a great many years. So it was simply a transition to greeting old friends in a new way. But it also allows us to open our deliberations to the world in a way that we, for some reason, had hitherto failed to imagine, or perhaps because technology has advanced so much. What was it you were saying, I think, Sarah, that the advances of 3 to 5 months are equivalent to those of 3 to 5 years in times past? Jean-Francois, you actually kicked off this series of comments and this conversation. Could I invite you to come back onto the screen to see if this has been of use and of interest to you? You've just been certainly highly and justly acknowledged by Kevin, but welcome back for a minute.
No, I think that thank you very much for all of your comments, and I fully agree. I will say that for me, leadership doesn't mean that we need to have one leader. My feeling is there is, globally speaking, a lack of leadership today in many situations, and that's the reason for which we want to engage. And I think it's something important that we don't mention enough, but we want to engage the young generation and the youth, which are going to face difficulties in the next years. What I want to mention and what I want to say is when I see 5 years back, it's very impressive to see, and I agree with what Dr. Nezar said, it's this kind of forum which make move the situation, because 5 years back, it was very difficult to speak about faith communities and health. And it's impressive to see that the work which is done at the level of organizations like WHO, and I want to mention to what Sarah and the team in WHO did concerning the consideration and the recommendation for religious leaders in the context of the COVID-19. This document presented by Tedros yesterday is also something important. And that's good to see the things are moving maybe too slowly for me, because I want to do it much more quicker. But we are in the right direction. And once again, it's good to hear that everybody is open to cope, to collaborate. And thank you for that. And thank you for the return.
Thank you, Jean-Francois. Sarah, I picked you arbitrarily, but now I see your hands up because I'm delighted. I was going to return to you to wrap up this phase of our program.
Thank you. Actually, I just wanted to pick up on a point that Kevin made, because I really liked his idea. Kevin, you spoke about COVID-19 being a uniting experience for everybody globally that could be a catalyst towards collaboration. And I think another thing that we're realizing, particularly from the public health perspective, is that health is not just the responsibility of health organizations and individuals, but there really is this what is a kind of an annoying cliche now, but the whole of society approach to health, but also the whole of society accountability. And I think that that's another very strong opportunity for partnerships and collaboration. And I just was wondering a little bit about how we could sell this idea to the leaders. And Rabbi Naomi, you spoke about caregiving as a transformative encounter, but maybe we can say that collaboration can also be a transformative encounter. So over from me.
Thank you, Sarah. Naomi, I wonder if I can invite you to hang on to a response to Sarah, because I suspect that you may well be able to employ your thoughts in a couple of the questions from our global participation base. As I mentioned earlier, Sana and Marlene have been keeping track of the chat box on our behalf. I'm not sure how it is for you, friends, but for me, the chat box, though fascinating, is an infinite distraction. So I'm appreciative, I should say, to Sana and to Marlene, not only for doing that, but for all the work. And I assure you, it's been a lot of work. Simply fielding my questions, Sana, has been a major task in the last 48 hours. So thank you to those behind the scenes who are managing the technology that makes this possible. a few of the questions that have come up, if we could spend 15 minutes or so, perhaps responding to them. This one I shall simply read directly because it leads from our roundtable conversation. What organizations and individuals are working on bringing religious leaders and policymakers together to create greater unity among humanity? And can any of the panelists name particular examples? So let me open that question up, and if you would like to signify, I think a show of hands will work. And I'll begin with whoever wishes to begin. Perhaps, Naomi, this is a good place for you to start. Oh, it looks like Jean-Francois is in, and Naomi somehow or other got cut off. But Jean-Francois, let's begin with you.
I think that we have more and more organizations trying to bridge religious leaders. And for example, the last one with which I worked was the UNAIDS initiative, the HIV Interfaith conference, which will hold in last September between UNAIDS and PEPFAR Faith Initiative. And we worked a lot with that organization to prepare and to be in touch with faith leaders in order to try to work on a common and global approach. Some others for me are organizations like the Global Fund. WHO is also, as I mentioned, one of them. For me, the key point should be that we have in those big partnership around HIV, around malaria, around tuberculosis, we have a very strong partnership with different constituencies. We have the private sector constituency, we have the civil society constituency, we have the NGOs constituency, and I think we need to push to have also a faith community constituency representing them in this global health landscape.
Thank you. Naomi, we're going to hope that the technology captures your comment this time.
Thank you. Organizations like the First Aid, like the Red Cross in the United States, has a long history of collaboration with faith communities. The chaplaincy field, which of course I've mentioned already, has many different locations. So the question is about with policymakers, and our conversation today is focused on public health and specifically the COVID crisis. There are chaplaincy within numerous different organizations. Of course, I know the United States best. Our government, our Congress has a chaplain. Our police departments have chaplains. Military has chaplains. So the point is made. There's already in the infrastructure in that context. I would like to highlight that CAICID is an organization which is bringing together policymakers, leaders in different NGOs and faith leaders.
Mm-hmm. Thank you for that. And of course, those of you who are familiar with the G20 Interfaith Forum, simply by being here today, will note that that is its principal raison d'etre, to bring together policy and faith. I should say, too, come to your distinction between local and global, and then to Marco, or not distinction, but you're noting the two, that 5 years ago, Professor Patrice Brodeur of CAICID and of the Université de Montréal had undertaken a global interfaith engagement mapping project in which, to turn to local leadership, Patrice identified by January of 2015, as I recall, nearly 6,000 places where interfaith dialogue and leadership is being made manifest worldwide. So the resources CAICID provides are just quite extraordinary. Marco, your hand was up.
Yes, I would like to say that part of the challenge is how we identify and locate faith communities. They are certainly a constituency, as Jean-François said, of course, and they need to be recognized as such, including in the organization. Speaking myself as a legal scholar in religious freedom, this is of course very dear to me. At the same time, I think that the challenge resides also in the fact that literacy about religion should be literacy about how the individual faithful and even parts of the communities can be everywhere. Individuals can be entrepreneurs, can be active members of the civil society in many different forms and ways. And as far as the science and technology challenge of COVID-19 and the pandemic is concerned, believers can be and are, in fact, in the science and technology community. And I think that their role in that specific context needs to be acknowledged, needs to be actually mobilized to some extent, although we also need to be aware of the risk of not altering the nature of those organizations. This is a major challenge. Believers are not outside the science and technology community. They're not outside the research and innovation community. They are full members of those, and they should be recognized as such without this undermining the recognition of faith communities as a constituency or organization.
At the risk of betraying my own faith tradition and certainly that of several others, amen, brother. To move along, if you will permit me, to the next question, or a next question at least. This one is a delicate but extremely important one. Some religious adherents have said that the virus is an act of God, so we ought not to worry. How do you address those kinds of perceptions, especially when they come from religious leaders themselves? Please, Nazar.
I think here it's very important, the unity. This is what I've worked with, I think, significantly in social media as a physician with people who are in religious leaders. People have to understand, I believe the first part of it was that to say that it is a virus, because some people thought that it is just an innovation of someone. So we insisted that this virus had a very well-known now genetic transformation. We spoke to the religious leaders to say that this is just the transformation that we've lived through with so many viruses, and science does not at all get away from its close bound to religion. And we've insisted that this is the science that God gave us, and everything comes from there. And we have to understand that it's part of, sometimes from our perspective, it's part of, like any other religion, every one of us get tested once in his life about his faith, about his patience, about his tolerance to disease, and communities also get tested about that. And I believe this worked as much as we don't do any kind of distinction and separation between science and religion. It's very important.
Mm-hmm. Thank you very much for that. I certainly, as we all do, appreciate the insight and the observation. The virus, if you like, has fairly credible antecedents. This didn't simply emerge from nowhere. It's part of the reality of life on this planet and perhaps everywhere in the cosmos. It is not a happy experience for human beings. it's difficult to understand actually how it's a happy experience for the virus. But nevertheless, like so many things in life, it isn't necessarily defeating an enemy, but learning to live with a reality. Are there others who would like to respond to that question? I have another following up around strategies and technicalities, but this strikes me as a fairly rich field for conversation. Now, I see Marco and Sarah both nodding. Sarah, from the WHO perspective, and we should acknowledge that we know that the WHO has been under some duress since the spring, but let me say on behalf of all of us just how much we appreciate who and your being here with us today. So perhaps I could turn to you.
Thanks. It's really my honor to be here today as well. But I think an important point that's already been brought up is that where there are situations that information is coming from a leader, a religious leader that might be contradictory to the science, it's really about open dialogue, about understanding where that information is coming from and ways in which we can use the knowledge and information and the science that we have to find a common ground of explaining and working together. And I think this could partly be one of the strategies that we could employ. I mean, at least from WHO's perspective, it's something that's very much on our minds, is working out how to support faith leaders much more concretely in their role as trusted sources of information. So it's easy to say that faith leaders are a conduit but through which information can flow and they're trusted. But then, and I think this goes back to something that Rabbi Naomi said about training, it's really something that we need to take seriously about how we capacitate and support faith leaders in that role of trusted speakers and having that link to the science and to the information and to the networks and to be able to create that safe space for capacity building and training, I think is something that we at least would really like to take a lot more seriously and work towards and look for partners to do that with, for sure.
Excellent. Marco, am I right that you wish to make an intervention?
No, I was just nodding. This is a key. This is a key point.
Nodding is good. It's very positive, Marco. Thank you.
Well, what has just been said about WHO, and I would really add the importance for universities and research institutes, public and private, to follow what has been said about the WHO. That's a great inspiration, a great template to be applied much beyond the WHO, actually.
Very much. Friends, we're coming very close to the closing time for this plenary. And before I offer a word of thanks and a very brief closing remark or two, might I simply turn things back over to you to see if there is anyone among you who would like to have a closing observation as we bring our time together to a conclusion. Naomi.
A thread that I heard throughout this discussion relates to the concept of understanding our audience. We're a diverse group on this panel, and when we were discussing research, I was thinking research is possible in spiritual care. It is true, not all can be measured, but each of us comes from a perspective which has different desired outcomes, and that's what we need to gear our research to, as well as how we build collaborations. And on this last point, when working with faith leaders, we also need to be thinking in terms of their perspectives and their priorities and values. So, of course, presenting science will be very effective with I would imagine, the majority of faith groups, but there are also some religious groups which don't accept science and scientific knowledge. So the parting thought I offer to us is, as we strengthen our collaborations, that we also learn what the desired outcomes are from our different perspectives, our different professions, as we come at the topic of the pandemic and the different contributions we each bring to its response and healing and caregiving at this time.
I see a number of heads nodding, and is there anyone else who wishes to make a concluding remark? Well, in that case, may I take a moment to say thank you to each of you, to Nazar, to Sarah, to Naomi, to Jean-Francois, to Kevin, to Marco, and to our panel's guest, Saeed, for your presence, your dedication, your willingness to be with us and to engage so candidly and insightfully. Stephen, Marco and I have a mutual friend and colleague, the author Robert J. Sawyer, who reminded us a few weeks ago that it was the late biologist Stephen Jay Gould who observed that science and religion are two discrete but overlapping magisteria. The task that this panel has set for it today was by no means an easy one, but you have all risen to the challenge with insight and with expertise and with grace, and I thank you for that very much. One of the things I should note is that Marco has recently taken on the position of chair of the working group of science, or rather religion, innovation, technology, and infrastructure for the Group of 20 Interfaith Foundation. And if you peruse our website from time to time, you will, I hope, find some extremely interesting insights offered there. I think they call that a moment for a commercial break. But in thanking you all, I want to recall to your mind a comment, a very lovely comment made by the late C.S. Lewis, who was a Christian novelist, thinker, evangelical philosopher, any number of things. Lewis had a great deal to say about friendship, which he felt was underestimated in the modern world, that is to say, his world of the 20th century. One of the observations that Lewis made is that there are moments in any gathering of friends when the insight will come to one or the other of those friends of just how fortunate they are to be in such good company. And I must say, as your moderator, I feel extremely fortunate and extremely blessed to have spent this time in such very, very good company. And friends in our more extended audience, in your company as well, virtual though it has been. Thank you very much, everyone, and I trust you will remain with us during the balance of this Interfaith Forum. Thank you, and God bless you.